everyone, what's up? You're watching Ayurvedic and in this video we're going to talk about a cluster of medical conditions affecting the upper gastrointestinal tract, known with various diagnostic terms such as acid reflux diseases, gastroesophageal reflux, gastritis, hyperacidity, gastric ulcers, peptic ulcer, etc. The reason why I'm going to explain all of them together in one single video is nothing but the similarity and common correspondence in their causes, symptoms, and treatments. The set of symptoms of these ailments may vary from person to person and time to time. So we take it as a metabolic syndrome that affects basically the digestive system, but it acts as an underlying cause for almost entire systemic illness of the body. Yes, we believe that stomach is the home of almost all diseases except the external traumas and injuries. So if untreated for a longer time, the symptoms can lead to actual peptic ulcers, internal bleeding, even carcinogenic changes, and can affect us psychologically too. Now the symptoms. So we'll discuss about the reasons later. The general symptoms are as follows. It can vary from person to person. Anorexia or loss of taste, aversion to food and nausea, the feeling of vomiting, the loss of appetite, early satiety, that means the feeling of being full after eating very little amount of food, bloating of the stomach, burping, heartburn, sour belching, headache, upper back and upper chest pain, pain in the flanks and the ribs, stomach ache, diarrhea, irritable bowel or constipation, flatulence, stress, mood changes, indigestion, etc. So many of these symptoms may resemble the heart-related issues. It is just the location that makes it mimic so. Let's see the reasons behind the manifestation of these conditions. First one is the irregular food timings, then delayed meals, skipping of meals, extremely spicy food like pickles, vinegar, etc. Medications like painkillers, etc. Loss of sleep at night, stressful atmosphere in the job and family, frequent use of antibiotics, family hereditary, genetic factors, smoking and alcohol, anxiety, etc. Now that it's almost a dozen of reasons. So doctors usually go for an endoscopy if the initial medications like antacids, etc. fail to manage the condition. So many of the early endoscopy results could be negative since it might take years to develop an actual ulcer. So initially there could be only mild gastritis and related evidence. So there could be also evidences of H.Pylori bacteria infestation. But I don't personally think that H.Pylori bacteria are the sole reason for having gastric ulcers, although it is found in most of the ulcer cases. And I think you don't need to wait until the proper ulcer formation to happen. That's like waiting to have an abnormal liver function test to quit alcohol. So Ayurveda has got medications to symptomatically treat you and to prevent every possible chances of getting an ulcer. So we have a very good range of remedies for this condition in Ayurveda. So unlike modern medicines, we have got medications to improve almost every aspects of the digestive process, like improving your appetite, your digestion, absorption, elimination, and to cure almost all the symptoms in a gastric disorder. So we've got a set of purification and detox methods like Snehapanam, Panchakarma, Shirodhara, etc. along with the internal medicines. So the prevention, of course, it's better than cure. The first one is always try to avoid all the earlier said triggering reasons as much as possible. Then improve the quality of your digestive process by controlling the quality and quantity of your food. You might need some kind of Ayurvedic medicines as well to accomplish that. So avoid self-medications and unwanted painkillers, antibiotics, etc. Reduce excess spicy and oily food. Avoid food additives like colors, artificial flavors, preservatives, and chemical taste enhancers. Exercise regularly. Make a time pattern for your meals, bath, and sleep. Have an early breakfast, lunch, and most importantly, an early dinner. Improve your metabolism and fine-tune your immune system. Eat accordingly with your digestive capacity and only after digesting the previous meal. So avoid cold fruits, ice cold beverages, and refrigerated foods. Have only freshly prepared food and avoid cold storage. Completely avoid pickles and vinegar. Quit smoking and reduce alcohol consumption. Of course, quitting is the best. And of course, most importantly, listen to what your body is trying to communicate with you. That's the most important one. Just follow your body. And as an add-on, I'll give you one more tip. Try to take things cool. Life can sometimes mess you up, but just be composed. Just chill. Because stress and your gastrointestinal responses are like bosom buddies, complementing each other. So try to be happy with what you have and do not be super anxious. So most of these patients are super suspicious, impatient, fluctuating decision makers, and they need to find their own crisis management to overcome the situation. So good luck with you for that. And that's quite more than enough for the day, I think. So hope you found this video helpful. And if yes, you can give me a thumbs up and subscribe to my channel. It can really motivate me to bring up you better content. So this is Dr. Sreeraj, living for the moment. Stay safe and take care. Until I see you in the next one. Bye-bye.